Hello guys, this is Dr. Navjot Kanwal and we'll be talking about pulmonary function tests today. So have you ever wondered why don't your lungs collapse after a forceful expiration like blowing a balloon? Don't worry, you'll get your answers at the end of the video. So what are these pulmonary function tests? These are non-invasive tests performed by your healthcare providers which basically measures your lung volumes, lung capacities, flow rate, and the rate of gases exchange, which are used by your healthcare providers to diagnose a condition and provide the necessary treatment. Now, these tests they are measured mostly by a spirometer. So you can see here this is an electronic spirometer over here, and let us go on to the lung volumes. The first lung volume to be considered is tidal volume. So the normal amount of the tidal volume is 500 ml. So what is this tidal volume actually? It is the normal air inspired and expired during a normal tidal respiration. The amount of air which goes in and out of our lungs during a normal breath. The arrow here, you can see this is inspiration and the downwards arrow here is expiration. The next lung volume is IRV, inspiratory reserve volume. The normal amount here is 3 to 3.5 liters. Now this is max forceful inspiration done above and over a normal inspiration, and it does not include tidal volume. You can see in this graph that this is our inspiration, expiration. This thing here is the tidal volume, but the inspiration above the tidal volume over here is IRV, our inspiratory reserve volume, and this does not include a TV. The next volume is ERV, expiratory reserve volume. The normal amount is 1.3 liters, and this is the maximum forceful expiration after a normal inspiration. Again, you can see here this is our tidal volume, this over here, this is inspiratory reserve volume, and this here is our expiratory reserve volume, the forceful expiration after a normal inspiration, after a normal expiration. Residual volume is our next volume. The normal amount is 1.2 liters. Now, what is this residual volume? This is an important thing to know. This is the air left in the lungs even after a maximum forceful expiration, which basically doesn't allow your lungs to collapse. Now, this RV is not measured by a spirometer. And but why is it measured by a spirometer? Because the high pressure during a forceful expiration, it compresses and closes the small airways. Therefore, the alveoli they get trapped and the air cannot come out. Now, this thing here, this mechanism here, this is called as dynamic compression of airways. Now, I said you earlier that the air that prevents our lungs from being collapsed after a forceful expiration. What was that? That is nothing but our residual volume. Now, this prevents our airways to collapse, and the amount of air that comes out when we blow a balloon is nothing but our ERV, our expiratory reserve volume, the maximum forceful expiration after a normal expiration, which is basically used to blow air into a balloon, and this prevents the collapse of the airways. Residual volume prevents the collapse of our airways. You can see here this is our normal airway. The air can go in, it can go out. This is the normal airway, perfectly dilated. But this here is our compressed airway and the air is trapped over here. This air trapped is known as residual volume. We are done with our volumes and we'll go to the next topic, which is capacities. Now, what are these capacities? They are nothing but sum of two or more values. The first capacity to be noted is inspiratory capacity. It is nothing but inspiratory reserve volume plus tidal volume, which gives us our inspiratory capacity. The normal amount is 3.5 to 4 liters. Then we have our expiratory capacity. It is expiratory reserve volume plus tidal volume, and the normal amount is 1.8 to 2 liters. Then we have functional residual capacity, which is expiratory reserve volume plus residual volume, which gives us functional residual capacity. The normal amount is 2.5 liters. Now, what is this functional residual capacity? It is the amount of air left in the lungs after a normal expiration or at rest. And you should differentiate this functional residual capacity from residual volume. which was the air left after a maximum forceful expiration, not at normal or at rest. So this thing should not be confused. So to help you a little bit, I have put a table over here. So the air after a forceful expiration, what comes out is our ERV and what stays in is RV. And after a normal expiration, what comes out is TV and what stays in the lungs is FRC. So, as said earlier, during blowing a balloon or a forceful expiration, what comes out is ERV and what stays in is RV, which prevents the collapse of our airways. Now, since RV won't come out, so we can't use a spirometer over here, so spirometer it fails to give FRC and RV. So how can we know what are the levels of our FRC and RV? So for that FRC estimation, we basically have single breath nitrogen washout test, Fowler method, which is basically used nowadays. It is the most commonly used. We have other two methods also, like helium dilution method and plethysmograph, but single breath nitrogen washout Fowler method is most commonly used. Now the benefit about this Fowler method is that it gives us dead space and closing volume. Now what is this closing volume? Closing volume is the volume at the first airway closure at DCA. DCA, you should know, it was dynamic compression of airways. And about the dead space, I'll talk to you about it in the next video. You will get to know about dead space in the next video. So the fourth capacity is vital capacity. Now this, what is this vital capacity? This vital capacity is nothing but maximum inspiration followed by maximum expiration. So vital capacity is IRV plus EV plus TRV, inspiratory reserve volume plus expiratory volume plus total residual volume. So this vital capacity is different in females and males. In males it is 4.8 liters, in females it is 3.2 liters. But why is it less in females? It is less in females because in females we have a small body size and less mass. Then we have our total lung capacity, which is the sum of all the four capacities: inspiratory reserve volume, expiratory reserve volume, tidal volume, residual volume, which gives us our total lung capacity. Now this total lung capacity, it has residual volume in it. That is why it is not measured by a spirometer and we have to use Fowler method over here. So as said earlier, what are the three conditions that require Fowler method instead of spirometry are residual volume, FRC and our TLC. Now I said that vital capacity is different in males and females, but what are the other conditions in which we can have a low vital capacity? Now these conditions are physiological conditions, basically not pathological. Physiological conditions are females, short stature, child, old people, in pregnancy and in supine position, that is in lying position, we can have low vital capacity. So these mentioned here, these are the physiological causes of low vital capacity. I'll talk about the pathological causes of low vital capacity in my next video. Here I have labeled actually all the volumes and all the capacities, so it will be easier for you to understand. This here, the upward arrow is our inspiration, the downward arrow is expiration. Now this is our tidal volume, which is normal inspiration and normal expiration. This is inspiratory reserve volume, the maximum forceful inspiration after a normal inspiration. ERV, maximum expiration after a normal inspiration, ERV over here. Now this is inspiratory capacity, which was IRV plus TV. This is our FRC, which was ERV plus RV. Now this over here, IRV plus tidal volume plus ERV is vital capacity, and all the volumes together and all the capacities together, they give us our total lung capacity. So now this graph over here, this is very important because this has been asked in NEET PG and AIMS as well. They have asked you to label a particular capacity or a particular volume. So you should be thorough with this graph and this should be on your fingertips. So I'll talk about the pathological conditions in my next video. Till then, just keep on studying and thank you for watching.